Substance abuse counseling. What is substance abuse counseling? According to the Cleveland Clinic, substance abuse counselors or addiction counselors help clients acquire treatment for substance abuse disorders. They also develop treatment plans based on the needs of their clients. Additionally, they provide emotional support for their client and their client's family. Substance abuse counselors work with groups, families, and individuals. How are substance abuse counselors important? According to the Mayo Clinic, substance abuse counselors help clients understand how substances affect the brain. They also help explain the difference between substance abuse and addiction. Addiction, which does differ from substance abuse, is substance abuse that causes chemical changes in the brain and is a chronic disease. Substance abuse, on the other hand, is the misuse or overuse of a substance. Over time, and depending on the substance, abuse can lead to addiction. However, if one were to abuse a substance, that does not necessarily mean they are addicted or that they're going to be addicted. However, the difference here is important to note as it affects the course of treatment. Substance abuse counselors also apply techniques to identify problems and risk factors as well as ways to overcome or avoid them. Some common risk factors for substance abuse include one's genetic makeup, their environment, and their mental health. When it comes to substance abuse counseling, there are numerous approaches. The most common approaches include behavioral therapies, motivational therapies, family counseling, and 12-step programs. Behavioral therapies. Behavioral therapies are the most popular approach to substance abuse counseling. One form of behavioral therapy is cognitive behavioral therapy. Used in many forms of counseling, CBT aims to help an individual anticipate, recognize, and avoid problematic behavior. It also helps instill within the client the skills necessary for handling urges and maintaining resistance or abstinence, as well as establish healthy coping strategies. This form of therapy is effective for most substance abuse disorders. Another form of behavioral therapy is dialectical behavioral therapy. DBT aims to help individuals control and maintain their emotions, as well as establish relaxation and coping skills in the face of adversity. This approach is effective for those who struggle with disorders in addition to substance abuse, such as mood, eating, and personality disorders. Then, the matrix model uses multiple techniques in order to help an individual deter relapse and help maintain their abstinence. Motivational therapy. Motivational therapies are the second most common approach to substance abuse. Motivational enhancement therapy is a form of motivational therapy that aims to reduce apprehension towards treatment and abstinence. It focuses more on client encouragement rather than education, like some other forms of counseling. Oftentimes, this approach is used in conjunction with other approaches. Contingency management and motivational incentives reinforce abstinence with tangible rewards such as vouchers and prizes. However, one must provide a drug-free screening in counseling in order to receive such a reward. Along with motivational enhancement therapy, this form of counseling is often used in addition to other approaches. Family counseling. In family counseling typically involves the whole family meeting with a therapist. Sometimes this is done in part and rarely done individually with one member going at a time. Substance abuse can affect the function and health of a family, so this approach can play an important role in recovery. One form of family therapy is behavioral couples therapy. BCT is meant for couples who are married or living together. With this approach, a client's abstinence is encouraged and rewarded with a recovery contract, which is where one partner agrees not to abuse and the other partner agrees to support their efforts. Through BCT, couples can improve their communication and reduce stress in their relationship. Brief strategic family therapy is aimed at adolescents with a substance abuse disorder. It is often characterized by a fixed number of sessions with a rigid treatment plan. According to research, adolescent substance abuse commonly stems from unhealthy family dynamics. So, this approach employs interventions focused on family interactions. And then family recovery support groups are support groups for those who have a loved one who suffers from a substance abuse disorder. 12-step programs. The first 12-step program was created by Alcoholics Anonymous in the 1930s to help individuals recover from alcoholism. Today, not only is this program used for alcohol, it is used to treat a wide variety of harmful and addictive behaviors and help those who have experienced trauma due to exposure to harmful and addictive behavior, whether it be first or second hand. Types of programs that have a 12-step program include Alcohol Anonymous, Adult Children of Alcoholics, Narcotics Anonymous, and Gamblers Anonymous. The main structure of the 12-step program goes as follows. Admit the problem exists and that one cannot handle it alone. Recognize that a higher power exists and provides strength, whether it be God, nature, or the universe. Examine mistakes of the past and understand where one went wrong. Make amends, attempt to build back bridges that have been burned, and ultimately make peace with others. Learn new, healthy behaviors and implement them into daily life. And then, eventually, help others begin the program and work their way through the steps.